Hello, this is Eugenia. Today I'm going to talk about the problems that I faced at work over a period of 3 years from the time I relocated to UK. In an earlier video entitled Being Chosen by God, I talked about spiritual attacks and a number of other issues that I have faced, and I did mention that I experienced problems at work. Problems started right from the first day at work, and these ranged from racial discrimination, harassment, bullying, victimization, etc. I'm just going to give a few examples under the different headings for the sake of time. Maybe in future videos I might expand on all the issues. When I started work, the nursing staff asked me what my duties were going to be on the ward. I explained to them that for the first few weeks I was going to shadow the consultant. I joked that I was going to be the consultant's tail. Soon after that, a number of nurses started saying that they were going to buy black dogs. I knew where that was coming from. It was because I had said I was going to be the consultant's tail. So what they would do is they would download photos of black dogs and pass their phones around before meetings, saying those were the black dogs that they were going to buy. So after 4 different people did that, I said I was also going to buy a black dog since everyone on the ward was buying a black dog, and the issue stopped temporarily. For the whole year that I worked with this team, the issue of the black dog would be brought up in different contexts before meetings, including one member of staff saying that there was a platform on which owners brought their dogs and their dogs would talk every morning. I knew that there was nothing of the sort, so I asked what platform that was, and she said it was a platform called Hooray on Instagram. I asked her to show me the platform, and of course, there was nothing of the sort. There were a whole lot of other issues that went on, and when I complained to management about this, they said there was going to be an investigation. I was going to be moved to a different hospital. I asked them to complete the investigation before I moved so that the issues would be concluded and they would not affect my next placement. Unfortunately, I was moved immediately. When I started work at the second hospital, confidential issues that were supposed to be under investigation at the first hospital were being discussed by team members. I suppose they simply asked their colleagues where I had been working, what had been going on. This already created problems at the second placement, which is exactly what I had tried to explain to management. I actually found out that the investigation had been completed from the team members I was working with. They were talking about it in my presence. They said all my complaints had been thrown out through the window. I contacted the investigating officer asking about the progress of the investigation. He confirmed that he had concluded the investigation and arranged for a meeting to tell me the outcome. He said he had found evidence of racism from the complaints that I had raised. He had also found evidence of homophobia among the staff themselves. He was going to work with the team to address these issues. 2 years later, towards the end of my contract, when I brought up this investigation in a discussion with management, the same investigating officer said he had not found any evidence of what I had complained about. This is not what he had told me at that time, but it matched what my teammates said at the time, that my complaints had been thrown out through the window. At the second hospital, the racial issues just continued to the extent that staff started spraying foul-smelling chemicals in the office I worked in. I complained to management, and one manager suggested that I could put a camera in the office so that we see who's doing this. A colleague even gave me her own camera to put in the office so that we see who it was. As the issue persisted, I eventually put a camera in the office and someone was caught on the camera. On this day, I left the office at 12 noon. My line manager got into the office at 2 p.m. and there was no smell in the office. Around 3:45, I got a notification that someone was in the office. Around 5 p.m., I went back to the office and the office was smelling. I called my line manager into the office and she was surprised that the office was smelling since she had been in there 3 hours earlier and there was no smell. A member of staff passing by exclaimed that my office was smelling again on this particular day. I forwarded to my line manager the video clip showing the culprit. The camera had been in the office for 4 days and everyone knew that there was a camera in the office. The next day, after this culprit had been caught, there was an information governance crisis. I was called for a 2-hour interrogation. I had not been aware that it was not allowed to place a camera in the office. I was not the only one who didn't know. A manager suggested that, and a colleague had given me their own camera. I apologized for placing the camera in the office. The trust wanted all the recordings destroyed and arranged a meeting with the data protection officer in the trust. I asked about the evidence of hate crime on the recordings, and they said they were not bothered about hate crime. They were only concerned about information governance. I was even threatened into deleting all the recordings because it was said I had committed a crime against the government of UK and I had gone against trust policy and GMC policy. I complained to management about all the racial issues that were going on at the second hospital, and the trust said they were going to carry out a second investigation. The investigation was concluded and they said they had not found any evidence of what I was complaining about, despite all the evidence that I provided them. I questioned the way they carried out their investigations. The investigation started 4 months after an investigator was appointed. I was only told the outcome of the investigation 4 months later. Meanwhile, the discrimination, harassment, bullying, victimization only got worse because my colleagues were actually being told that they were not doing what they were doing. They continued spraying the foul-smelling chemical in my office till I left. I raised concerns about patient management and investigations with management up to senior management, including the clinical director and the CEO. I was told to stop emailing senior management with my concerns. I said I would not stop as long as patients' lives were at risk. One of the patients ended up being admitted. The second patient developed complications that required medical investigations and further management. After my last email, the clinical director responded saying that I had been raising important issues about patient management which required urgent attention. On the next day, one of the line managers said I was being placed on sick leave with immediate effect. I asked if this was because on the previous day the clinical director had said patient management issues needed to be addressed urgently. She said it was because I had said I had become depressed because of the ongoing issues at the workplace. I told her that I was on antidepressants for 2 months and my depression was in remission. I was happy to continue working till they transferred me to another hospital since they were not addressing the workplace issue. Her response was that I was not supposed to step into the workplace with immediate effect. If I was not sick, then I was being placed on a special leave. I was expected to have an occupational health assessment. I asked what the use of a third occupational health assessment was if they had not followed the recommendations from the first two, which said they were supposed to address workplace issues. I asked if the expectation was to be told that I was not fit to work. They also wanted me to have a psychiatric assessment. I asked why I required a psychiatric assessment. The GP who was treating my depression did not have any concern. They would not respond. Eventually, one of the directors said they wanted to make sure that it was not because of my neurodivergence that I was not accepting the outcomes of the two investigations the trust had carried out. These are the two investigations that had dismissed everything I had raised, including issues that were still ongoing at that time. As a result of all the racial issues that I was raising, I was told that I was not going to be offered another post at the end of my 3-year contract. This is despite my colleagues going for interviews and being offered posts. This in itself is racial discrimination. I was told that if I wanted to stay in UK, then I was supposed to start applying for posts elsewhere. I didn't have a problem with that, considering everything that had transpired. I started applying for jobs in other trusts. Meanwhile, the trust was consulting practitioner performance advice. One of the directors later explained that they were consulting PPA to get advice on how to treat me so that I do not take legal action against the trust. Based on the information they gave the PPA advisor, they agreed to look out for any of my reference letters and for the trust to have a discussion with prospective employers. Was this to help me get a job? Your guess is as good as mine. The meetings with PPA continued till June 2025, despite my contract ending on the 15th of January 2025. The trust continued looking out for my reference letters and intended to discuss with prospective employers. What surprised me from the record of the meetings they had with PPA was the preoccupation with my visa status and my whereabouts, even 5 months after leaving the trust. The trust would not give me a job. They sabotaged my chances of getting a job elsewhere, and they even sabotaged my final examination, which could have allowed me to pursue higher training. Their aim was for me to leave UK. I hired an employment solicitor and started employment tribunal proceedings. I also hired an immigration solicitor. It's been 12 months of unemployment. Having been on a work visa, I'm not entitled to any benefits at all. I had saved enough money for a house deposit, and I was thinking I was going to be on the property ladder. After being in UK for 3 years, I was looking forward to getting my dream car on finance, which is the minimum period required. And I had a number of options towards registering as a specialist psychiatrist. But all that changed, and I found myself unemployed with lots of legal fees and bills. There are a lot of things that I shall talk about. 1, how do you survive in the UK without any income? 2, how's my employment tribunal hearing going? The final hearing shall be held 21 months after my last job, almost 2 years. 3, how's my immigration case going? 4, when you face problems similar to the ones that I faced, what do? Do you just look for a job elsewhere and move on? Pack your bags and go back to your home country? Or stand up for what you believe in and fight for justice? Thank you.